Thank you very much. I'm Alison Corcoran, and I am delighted and honored to be here today representing the DentaQuest Partnership for Oral Health Advancement. Those of you in the audience, probably many of you know the two present organizations are DentaQuest Foundation and the DentaQuest Institute. What we have done is we have now combined those into one single organization. And it is really dedicated to trying to participate in partnership with you in the room and others across the country to drive significant change in the oral health ecosystem. Marco referred to his group as being data wonks. I think that was the term you used.
Yes.
I would say that we would describe the DentaQuest partnership as being filled with change agents. So what we really are trying to do in partnership with you is help drive change in a fundamentally broken system from the inside out. And we're trying to do this through philanthropy, through advocacy, and through innovation. We have made a decision to be a little bit more focused in how we are moving forward in this arena. We're continuing to be very strong and active participants in the Oral Health Progress and Equity Network, the Open Network, which you may have known formerly as the Oral Health 2020 Network, and we are continue to be firmly behind that. But we're also gathering and garnering our resources to try and have a bigger impact in three areas where we think DentaQuest across our entire entity probably can be the most effective. The first is in a sort of driving towards consensus on a single oral health measurement system. The second is really thinking about person-centered care, interprofessional practice, value-based care. How do we advance that more rapidly in oral health? And then, per the topic today, really driving and advocating for an adult benefit for oral health, both at the state level through supporting those states that are thinking about expanding Medicaid, their Medicaid benefit, but also in a very exciting way as part of the movement I think that we have here to push forward an adult benefit as part of Medicare. And as Mike said, I'm 2 years into the healthcare world. My background is as an MBA and from a marketing background, so a very strong sort of focus on what's happening out there with customers. And I have one data slide. It's a marketing data slide, but it's really designed to try and demonstrate what I think we all emotionally feel, that there is truly momentum building now for a dental benefit to Medicare. You can see this both in terms of the number of bills filed, the number of public letters written in support of that, the number of articles that have been written where this has been a major topic, and even the number of citations in a Google search that says has Medicare and dental together in there. The data for 2019 is obviously only through April, and you can see that this momentum is really moving forward. And so I guess I'm here to say the time to act on this is now. And I was particularly struck by what Congresswoman Shalala said about taking this to the American people. So as a marketer, you always have the best opportunity when you have both a scientific rationale, or you've got facts, and you have some emotional or some kind of connection associated with this. And I think that we are at the point right now where we need to, as an ecosystem, agree that we need to step up, push forward, and keep driving this. And so I'm delighted to introduce Peter Mitchell next. Beth Truitt sent me down, and I first had an introduction on the work that Oral Health America was sponsoring on this topic of engaging seniors get them activated to help us drive this change. And Peter's now going to share this campaign, which I think is extraordinary.